I am able to use all of my nursing skills.
My feeling is that I have actually made an improvement in the overall social well-being of the society.
I've always enjoyed the challenges of working at Wexford Health.
I love working for Wexford Health.
I wanted to make a difference in people's lives. That's why I'm a nurse.
My experiences between the general population and the prison population of healthcare is that they actually receive a much higher level of care in the prison healthcare population. And many of these offenders did not have health insurance prior to their incarceration.
You think when they were on the street, would they really go see a doctor?
Many of them had not seen a doctor for decades.
Here, they come up here, they get taken care of, and they get the treatment that they need.
I am picking up the pieces of much farther along disease than I would have in the general population.
And you have a variety of what you're going to be treating.
Somebody who has chlamydia, that's 18 years old.
And you have some of these elderly people that have congestive heart failure.
All of the typical diseases of adult males, including high blood pressure, diabetes, and strokes.
You never know what to expect.
In the ordinary clinic setting, it's the same thing every day. You go in, you do the same thing repeatedly. In corrections, it's just different every day.
You never know what may take place.
We certainly have X-ray 5 days a week. We have lab 7 days a week, and we can do our own EKGs. I do my own biopsies. I have staff that are equipped to provide me with surgical equipment, and I'm able to do minor surgeries, lacerations, and repairs.
We have a dental hygienist, we have a dentist full-time, we have a physician full-time that's on call 24 hours a day. He works 40 hours a week. We have optometry.
Telemedicine consultation through the Wexford Health source. And I have specialists in liver disease and kidney disease and psychiatry that I did not have in my own private practice that I can access through video conferencing and telephone calls with one step.
I believe they're still getting the same care they get in the hospital situation.
They know on the streets that they wouldn't be getting the care that they are getting in here.
Yes, I do believe that they care or appreciate what we do for them.
Because we have a comprehensive health plan, they appreciate the fact that we are giving them individualized care. One of my chief roles is to educate the inmates about what is going on in their health and how we are making steps to improve them.
We have the ability here to educate the inmates. We have several programs, especially our diabetic program.
A lot of inmates that have like high blood pressures and high cholesterol levels, and we have to educate them how to bring those down, not only with the medication, but by their diet and exercising.
And so education is at least 50% of my time. In addition to that, my day is also partially involved with the administration of a large healthcare unit with a diverse population. A career in corrections allows me to practice medicine and not have to run the business of medicine. Well, certainly the high cost of malpractice was killing me in the general practice, and now it is not a consideration at all. My burden of paperwork is a fraction of what it was in my private practice previous life, because I had an entire staff committed to filing claims and making phone calls to be paid. Prior to working in corrections, I typically had to work between 60 and 80 hours a week just to make ends meet in the practice that I was running. Now that I'm in corrections, I can expect to work between 40 and 44 hours a week.
At the hospital, I used to do 12-hour shifts, 7 to 7. Here I do either 5:30 to 4 or 6:30 to 5.
It's 4 10-hour shifts at this facility.
Now working in corrections, I have a legitimate lifestyle.
It's nice because I have a child, so I'm home every evening with him when he gets home from school.
I think that safety is a consideration, obviously.
You always have to think of safety first.
And so we have to add another layer of protection to the population on top of giving good medical care too.
I have always felt very safe in the correction setting that I work in.
But it certainly is no greater a challenge to me now than when I was in the general community.
Here at this facility, I feel very safe. There's always a guard with us. The inmates are usually very respectful of us.
In a clinical setting, you could be in a room with a patient and they just grab you. Who's going to hear you?
I think that safety is actually less of a concern for me because there are corrections officers and security and cameras, which I did not have access to in the general community.
I've accomplished a lot. I mean, Just like with any job, it does get frustrating. You feel like you could have done more, but I still feel like I get a lot done every day.
I believe in my role as a healthcare administrator and medical director in a prison. I'm using all of the administrative and medical skills that I was gifted with.
It's kind of rewarding because we do have a little bit of autonomy here where we can make decisions, our own decisions, don't have to ask the doctor for everything.
I chose a career in nursing because I wanted to make a difference.
It's challenging, very challenging, and I can't see me ever going back to the hospital after being here. I love it. I love working corrections.